Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and today our patient is Chelsea. She's been dealing with some neck and shoulder problems. So tell us about your neck and your shoulder, and when did this all start?
Started about 6 months ago. I work a lot. Overuse of my shoulder has caused inflammation, pain with movement, has caused my neck to be really tight and stiff. Anything irritates it.
And nothing in particular started this problem 6 months ago?
No known injury.
And sometimes it shoots down to your hand,
Yep.
right?
Shoots down my hand, causes my fingers to go numb at times.
Okay. And have you received chiropractic care before?
Never.
Never. Okay. What, have you heard anything good? Heard anything bad?
I have heard that I need it.
Okay.
Just haven't done it yet.
Okay, good. Okay, so after looking through her x-rays and her physical examination, we saw definitely restriction in her neck range of motion, and there's always contributing factors. When the neck doesn't move great, it adds a lot more stress on the shoulders. We saw all sorts of pain and discomfort. She could only raise the right shoulder a certain range of motion before a lot of pain and discomfort, both in flexion, abduction, and internal and external rotation. So there's a lot for us to do. She did say in the past she's had an MRI where it revealed bone spurring and degeneration in her AC joint. So we're going to attack right at that AC joint and the shoulder girdle to see if we can't get some of the stress and the contributing factors off of that area. You ready?
Yes.
Okay. So I'm feeling for any, number one, muscles that are tighter than they should be in your neck, but also restriction in any of your joints. You've not received a chiropractic treatment before.
No.
So this will be a little different for you probably. The scalenes over here are pretty tight. They're one of the main muscles that really get overburdened and try to stabilize in the spine, the neck. All right, so I definitely feel some restriction right there.
Okay.
So I want to restore good motion to the neck. So we're going to do an adjustment right there, okay?
Okay.
All right, right there, okay?
Okay.
Very good. And that restores a little bit of good motion there. I think you're going to like this one more. All right, ready?
Yep. Yes.
So what I'm going to do is I'm going to start doing some muscle tests.
Okay.
They're going to tell me what's working great, what's not working so great, okay? So I'm going to start right over here. Make a fist for me. What I'm going to do is push your elbow down towards the table.
Okay.
I want you to resist that, okay?
Okay.
Ready, go. And again, that's difficult.
Yeah, that first time my shoulder popped.
And is painful?
Yeah.
Okay. So now what I'm going to do is I'm actually going to come in here directly to that AC joint.
Okay.
So what we can do is start restoring the stabilizing forces around that injured joint.
Okay.
Okay? So I'm going to do a little adjustment right there. Good.
Okay.
Make a fist. I'm going to push down. Okay. Resist. And that's a lot stronger, isn't it?
Yeah, it is a lot stronger.
So that was the coracobrachialis muscle,
Okay.
which attaches in the shoulder girdle and helps support the overall AC joint.
Okay.
So that's good. Your thumb and your pinky, bring them together like that. I'm going to pull them apart. Don't let me do that. Come on. All right. A little weak there, huh?
I'm left-handed.
Well.
I'm still weak.
So those muscles, the nerve roots that control that movement, they come out of your neck right here. So we're going to do a little adjustment, a little bit lower, right there. Drop. Very good. Thumb and pinky. Pulling apart. Look at that.
Oh my gosh.
Not bad, huh?
Wow.
Okay. Elbow in at your torso. What I'm going to do is pull your elbow like so.
Okay.
And you're going to resist that.
Okay.
Ready? And that's tough to do. Okay, so here's what's going to happen. I'm going to stick my thumb in your armpit. I'm going to wrap my hand around your shoulder blade.
Okay.
We're going to adjust the articulations between your ribs and your shoulder blade.
Okay.
All right, so.
Can you feel it popping?
Yeah, it's already kind of popping. Take a deep breath. Breathe on out. Very good. All right, that same muscle test, I'm going to pull your elbow out. Resist. Much stronger, huh?
Much stronger.
Awesome. Okay. So now what we're thinking about is your mid-back, your thoracic spine, making sure that you have the flexibility and movement to support your shoulder and shoulder girdle movement. We definitely have some restriction here. So what I want you to do is put your chin to your chest, deep breath, breathe out. Very good. And put your chin to your chest again, kind of like a sit-up. There you go. Okay, good. So this is called motion palpation. I'm feeling for any restrictions in your rib cage and thoracic spine, and I definitely feel some right here.
Okay.
Okay, so tilt your head over here just a little bit. Take a deep breath and breathe on out. Good. And another one. Deep breath. Breathe out. Very good. So I'm releasing the pec minor muscle, which is an important muscle when it comes to the AC joint and the shoulder girdle.
Okay.
Plenty of muscular tension in there, huh?
Oh yeah.
Does it hurt when I do this?
You can feel the tightness. It's tender, but it's not. Yeah, you can tell there's like tightness, a lot of tightness.
Try your best to let it go.
My shoulder is popped.
Yeah.
That hurts.
Okay. Good. Okay. Okay. So keep your teeth together. Touch your chin up to your chest and down. Do you feel your shoulder pain when you do that?
No.
Turn your head to the left as far as you can. Now all the way to the right. Good. Did you feel any shoulder discomfort with either of those two?
Neither.
Good. Your left arm, raise it back as far as you can. No problem, right?
No problem.
Now the right one. And down. First of all, congrats. That range of motion was amazing compared to what we've been doing.
Yeah.
Did you feel discomfort, though?
No.
You felt no discomfort?
I really didn't.
That's awesome. Now, left arm all the way up. I'm going to do a muscle test.
Okay.
I'm going to lift up on your arm, and you're just going to resist me, okay?
Okay.
So put it all the way down, and now resist my motion. Pretty strong. Right side. First, I'll let it all the way, And I'm going to lift up. And that, any irritation?
No.
Wow. That's pretty great.
It really is.
And what I want you to do, keep your elbow straight, raise up this arm as high as you can. And down, and now the right one. What did you feel there?
A little tightness, just the higher, like up there, but it doesn't hurt.
Okay. Raise this one up as high as you can.
Okay.
I'm going to push down. I'm going to do a muscle test. Resist my pressure.
Okay.
And that's pretty tough. Let's do the right one. And that's pretty tough as well. Was there discomfort?
No.
Okay, good. But it was a less range of motion, yes?
Yes.
Okay. Let's just try something here.
Okay.
Your left leg, raise it up off the table. Hold it right there, and now raise this up as high as you can. And down. And down with the leg. That exercise we gave you.
Yes.
So you were laying on your belly, and you found a limitation in raising your arm up.
Right.
So what we had you do was raise your other leg to engage your core, and then that improved the range of motion and the ease of movement of your shoulder.
Yeah.
What was that like for you?
I didn't realize that could do that, but it does help a lot in releasing that limit that I had there.
Yeah. What matters here is by raising your opposite leg,
Right.
it engaged your core and your stabilizing forces of your spine and your shoulder girdle. And once you had that stability and control that your
Better
body has been
support.
craving, suddenly your pain-free range of motion drastically increased. And that's how we rehabilitate or we heal an injured body part. What I want you to do is raise your left arm out into abduction.
Okay.
I'm sorry, your right arm into abduction until you feel pain or discomfort.
Right there.
Great.
A lot better.
Now, turn to that wall
Okay.
and put your right arm out in front and slowly raise it until you feel pain or discomfort. Okay. Good. So, high five. That's great.
That is
You have
great.
way more range of motion. You're not fixed yet.
Right.
But that was a great treatment. That's going to get you started
That
as
helped tremendously
there you go.
already.
Good. Okay, so that was our treatment.
Great.
How'd that go, Chelsea?
Tremendous help. It feels a lot better already.
Yeah?
Yes.
What specifically feels better?
I don't feel any tension or tightness in my shoulder or my neck. I felt before that this was almost locked up. I feel relief. I don't feel like I need to pop my neck on my own, or I feel a lot of relief.
That's great.
Thank you.
Okay, well, you're welcome. Now, listen, you're not fixed.
Right.
The average chiropractic patient comes in and does 2 to 3 visits a week
Okay.
for 2 to 3 weeks.
Okay.
An initial course of treatment when the major lifting is done as far as rearranging how your posture, your movement, your control of the area.
Okay.
So you are not fixed as of one treatment.
Right.
But I think it was a great first treatment.
Yes.
And if you choose that you want to come back for the rest of that, then we're here to help you with that, okay?
Okay.
Don't be surprised if you're a little stiff and sore.
I'm expecting it, but
All right.
it feels great right now.
Great. Well, I'm Dr. Scott Hoar. This was Treatment Tuesday. Thank you so much for tuning in. Don't forget to hit the subscribe button, the like button, leave a comment below, and look for our next Treatment Tuesday. Bye-bye.